Today on First Consult, we will be talking about perimenopause and menopause.
I find there's a lot of fear about menopause.
Most people just associate it with getting to the end of your childbearing years.
Angry, anxiety, depression.
It feels like there are cockroaches crawling under my skin.
Changes to my hair and changes to my skin and my sleep.
The biggest issue for me was grief, and that was really hard.
I'm Dr. Anjali. I've been a GP in Sydney for the last 10 years, and before that in the UK, and I practice in all aspects of general practice. Today on First Consult, we will be talking about perimenopause and menopause, something very close to my heart. I'm very grateful for my special guest, Associate Professor Teresa Mitchell-Paterson, who's also a very good friend, who lectures at Torrens University in nutritional medicine. She also practices as a naturopath. If I did all your titles and roles, I'd be here till tomorrow. But I'm very impressed. You also used to do nutritional advice with Bowel Cancer Australia.
Yes, that's correct. 14 years.
That was amazing, as well as all the other podcasts that you do. Thank you for coming.
Nice to be here.
And thank you, Jess, for coming, a very good friend and works as director level in pharmaceutical industry. And she's been a technician in nuclear medicine in the past.
Correct.
And now she has a very busy role doing all of that, but looking after a preteen, 2 dogs, timetabling the whole family, and a very, very lovely partner.
Thank you for having me.
Perimenopause in the medical community is known as the time that you have transitional changes and symptoms that we're going to talk about today. And menopause is the time that you haven't had periods for more than 2 years if you're under 50, and no periods for more than 1 year if you're over 50. May I ask you what brought you here today, and what do you think you're here to do?
Well, I just wanted to talk about my experience with menopause, and also to talk about some of the questions that I asked you on the hop, but I would like to sort of share that experience with whoever may be listening, because I think, me as a natural therapist, I just want to say that I'm not adverse to people having hormone replacement therapy. And there are definitely times when women need to have hormone replacement therapy. We have to remember that there's a slight difference between herbs and nutrition and food managing menopause and the medications that you can get. And I think that's where you can illuminate the general public and also help me in my plight.
And I would love to do that. I think we're going to cover most of those topics now that you've brought them up, because I'm here to help you as your friend and your community, as well as a GP and a family practitioner. Jess, can I ask you why you're here today?
I'd like to echo what you said, Teresa. At the start of it, I think, I'd like to be more aware of what's out there, but I'd also like to be part of this initiative of raising awareness and just talking about it, because it wasn't something that I spoke to my mom about. It would be good to start the conversation so that women my age, but also women that are younger, sort of know what to expect and not to be afraid to talk about it. And also to see what options they have out there, be it herbs or medication or what have you, but just, to be part of that discussion.
And you probably didn't talk about it with your mum, because I think culturally we were probably taught that all the feelings and symptoms we're getting with perimenopause is part of possibly aging, possibly a busy lifestyle and multitasking as a woman.
Yeah.
If I could bring up our really recent trip with all the families where I had to sit you down and have an intervention as your very good friend, I really felt like I needed to. And I do want to impress upon our listeners that having that community of women or men, I don't want to exclude them, and family members to talk about how you're feeling and the symptoms of perimenopause or menopause wherever you are is so very important. Do you get to speak about that now with others?
I do now. And I guess, you had picked up on some things, but I guess one of the reasons why I think this is so important is because we need to be highlighting the breadth of symptoms. And most people just associate it with getting to the end of your childbearing years. But for me, that was the furthest thing from my mind. I had nearly a teenage boy. Having children wasn't on my radar, but I was experiencing changes to my hair and changes to my skin and my digestion. My sleep was something that was definitely really affected, and just an overall feeling of being overwhelmed. And these are things that you had noticed. And I probably wouldn't have put two and two together, that these are all encompassing of the changes that you go through in life. And so I would like to be, I would like it to be that it is a conversation that we are freely having, and just raising awareness of what menopause can look like. It's not just...
normally people talk about hot flushes.
Yes.
That's the traditional way of describing menopause. And I think the fact...
And I wasn't getting those because I had been on the pill for the last 10 years, and it was a really good hormonal management, I guess more for moods. And so I wasn't getting those typical symptoms, but I was definitely in hindsight, I was noticing that there were others, particularly that feeling of being overwhelmed. And, that is a feeling that I think a lot of women have when they have children, demanding careers. You sort of brush it under the rug thinking that is what it is. But in fact, there's so much more going on.
Absolutely.
And so that's why it's good that we raise awareness so that other people can recognize, that is actually something that I was feeling too.
And you've definitely become a beacon of that, I think, since we've had a chat. I do have to say, your vocabulary at the time and what you were saying, like you were very overwhelmed, you then, I hope you don't mind me saying, kind of gaslighted yourself and talked a little bit about how busy you were and how many after school activities you had to attend.
But I think we all feel that way. And I wouldn't say that there was any one or any particular thing that led to that, but it's because we don't talk about this. It's because that we don't have these conversations where everyone is aware of what menopause can look like.
Absolutely.
That by default, you just think, I'm very busy.
You're very busy.
I think, I have a full-time job, which is my son's chauffeur. Then I have another full-time job, which is my work in the pharma industry, which is global. So I'm on the phone basically from 6 a.m. till 10 p.m. on any given day.
And then timetabling the whole family.
Yes.
Correctly.
And so that is, I'm exhausted just even thinking about that. But if we don't have these conversations, you don't realize, I had another friend who started developing paralyzing anxiety and was another pharmaceutical professional used to presenting in front of large audiences. And then literally within weeks just felt this overwhelming anxiety. And I don't think people realize that, again, that is another thing that could be happening at this age.
And the idea is that building that community helps you understand where you've shifted from the baseline,
And you were good at objectively
looking at the fact that it's shifted from the baseline. Like all of these things could have another causative factor, like an environmental change, like moving or a separation. But the idea is that if you're not functioning correctly, then we do have to address the fact that we are changing or moving through this transitional phase. So you can also do that very well. So if I move to Teresa and I say, look, like as a friend and a colleague, I've probably seen her manage this so well. Looks like, from the objective perspective, you've done everything right in terms of nutrition, which obviously would happen with all your qualifications, Teresa. But what's your perspective of perimenopause and menopause?
So I have a slightly different view in that I think the biggest issue for me as I went into perimenopause was grief.
Oh.
Because I did want to have more children. And I knew that I'd got to the stage where it wasn't going to happen. And that was really hard for me.
Yeah.
So it was an adjustment disorder. And I think I was very much depressed at that time when I realized that was the situation. And looking back on it, when I think about what my mum went through, I remember my dad sitting on a step with her with his arm around her, and she was just sobbing her heart out. And we didn't understand why. And I didn't know why she was crying. But when I look back on the timing of it, she was going through menopause. And she'd recently been in hospital. And I think she'd had a hysterectomy for very heavy bleeding. So, I knew nothing about all of those types of things, but what I did know and what I did have was a network around me. So you can imagine lecturing at a university. I have a tribe.
You do.
And my tribe was fortunately mostly all going through a similar situation as me, perimenopause and then into menopause. So I think you have to, from my point of view, I had to tick all of the boxes. And that does require a lot of effort. The way that I managed it, exercise like an absolute maniac.
And you still do, Teresa.
Still do.
You don't want to do a kickboxing competition with Teresa.
Yes. No, and I'm also a black belt in Taekwondo.
Note to self.
So exercise was probably the best output for me, because I found that if there were any stages that I was going through where I felt like I wasn't managing, I would just kick and punch. And that really did help me. Perspiring a lot, eating well. There were some supplements that I took. I don't think that they played quite the same part as the diet and the exercise. But in lots of ways, I breezed through. Very different picture to my mum, who didn't do any of those things.
Was not proactive with the management.
Probably didn't know, to be honest.
No, and
it's a different time.
Different
we
era.
know to prioritize exercise and things like that. That generation just took care of the family. They're notorious for neglecting their own needs. So
the exercise is so very important for mental health, which what you're bringing up very rightly, but also in bone health. Actually, we do need to position ourselves to do a lot more weight-bearing exercise, whether it be walking. I mean, I would love to do the taekwondo and the kickboxing investment of time you do every week, but I feel like with the children, I probably couldn't do that. So I kind of nab in 3 or 4 times a week a weights class or a walk, to help me along the way. But it is absolutely necessary in these days in our very stagnant lives, like in office work, where we don't get the movement that we really need to do, or the weightlifting that our bones need to do, so that the making up cells in the bones are working more than the taking away cells. So I'm trying very hard not to get into medical terms, but bone is fully active. It's not static. So actually we need to help it continue to be dense. And osteoporosis is probably what we're trying to avoid while we kind of transition out of having higher levels of estrogen. And then as it reduces, then we have a change in the metabolism of the bone. But the other things that you, I think, are excellent at, and I actually refer some of my patients to you, is to help with nutritional value of our intake in terms of protein.
Yes.
So keeping up a certain grammage. I usually say 1.2 grams per kilogram of protein. Yeah. Is that kind of what you might?
Well, the evidence is swinging more to postmenopausally 2 grams.
Wow.
And that is a lot of protein.
It is.
So when you consider that, you have 100 grams of steak and 20 grams of that is actually the true protein.
That's right.
Then that starts to edge up to a lot of food.
It is.
And it's kind of difficult to get that in. But
I was just going to say, I think I would struggle to get that. So what would that look like in a day?
Yeah. I mean, when we go out for dinner, where I'm always saying to you, where's the protein bit of our dinner, even though I should really enjoy myself. And I'm very aware the large tin of tuna, the 435 grams version of tuna is only 30 grams of protein.
Yes.
So goodness, how can I get...
And would you need 2 of those then?
So per kilogram. So if you're a 60 kilogram lady, then it would be kind of, 70 to 80 grams. So that would be 2 of those plus a bit more.
So stuffing yourself with protein gets a bit boring. So I kind of, from research that I've looked at, because I want my bone density to be fantastic. And as you know, it's part of the structure of bone, but also your immunity. And also, I quite like my muscles. I have very well formed muscles for a person of my age. So I start the morning off with something like a protein shake, and then I have my breakfast, which may be some high protein Greek yogurt or a couple of eggs, and then lunchtime I'm going to have some tuna, or maybe some chicken, or maybe some tofu even. And then mid-afternoon, I usually have a bit of fruit, maybe some nuts, and then dinner protein again. And if I'm exercising, I'll probably have a bit more plant protein. But that's the only way I
So you're
manage
bumping
it.
up, you're kind of bumping up your protein intake with the shakes, which I would
Yes.
suggest, because then the other thing about protein shakes is, just for gut health purposes, it doesn't allow you to chew. Chewing
No.
gets your digestion going, your digestive enzymes going. So I do prefer the protein in a natural, but you're right, natural sense. But you're right. The idea is, if we did it all in the natural sense, we would have another job to get the protein in.
You certainly do. And you can buy some plant protein powders that are pre-digested.
Wow, that's great.
Yeah.
So that's an option. I mean, I do think eggs are the cheat, because 10
Love
grams of
eggs.
protein per large egg, that's definitely the cheat. You could boil that and you know you're hungry and you have that as an extra. That is always my cheat sheet. And the other thing that I've always talked to patients about when it comes to tuna is, it's a large fish in some species, and the larger you are up on the ecosystem, the more mercury you have. So actually getting the cheap brands with the skipjack tuna, which is the small stuff, actually brings your mercury content down in the fish, and it's not such a large fish. So you can do tinned tuna as, a regular.
You
with
certainly
that type of
can.
thing.
You certainly can.
So that's so important. I think you have made it look so easy. Then I did want to come back to the definition, because you have defined perimenopause and menopause as a cohort of symptoms. And I would suggest that perimenopause is a transition of our hormones wildly changing sometimes from the end of our 30s. And that's where ladies do get missed. End of our 30s, all the way up to the point that our ovaries decide that they may or may not ovulate every month. And maybe the end might be 55 when the ovaries stop, but our symptoms don't stop. So our menopause also requires active management. Saying that, I would suggest that the perimenopause is the hardest phase, the phase that we gaslight ourselves and our neurocognition. And you were saying about being angry. There are so many symptoms: angry, anxiety, depression, crawling feelings under the skin.
I still get them.
Wow.
It's the most bizarre thing. It feels like there are cockroaches crawling under my skin.
And then you look at your
I've
skin.
heard of that,
it's
and
not
I've
there.
heard of that being related to increased cortisol. I keep hearing
Well,
about
that's
that.
not a surprise.
I'd say cortisol is a stress hormone. So it's probably entirely true. It's not evidence in terms of conventional medicine's ever tested the levels of cortisol, but probably if you grind down to the reason, it might be the fact that we've got these transitional, wildly variable changes of estrogen and progesterone going on in our body. So definitely the crawling feelings have been associated with the perimenopause or menopause. And I feel like there will be a future umbrella term that takes over both of those titles, because I feel like the management now is kind of the same across the board. We do need to ensure that we have the protein content, the exercise. We need to ensure that we consider other, might be supplements or HRT, or nowadays called menopause hormonal therapy, because HRT can encompass oral contraceptive pills. So coming on to contraception in the perimenopause and menopause, because we can still get pregnant. What did you ever think of that? I mean, you're still on the pill.
Yeah. And it's I'm told it's a lower dose one, so I need to be cautious about that. But I had early ovarian failure, so I don't think that that's an issue for me anymore.
Yes.
But yes, I have been on the oral contraception, but I'm very soon going to be transitioning to, I guess, a menopausal,
a truly
replacement therapy.
Menopausal hormonal therapy. Great. The history has been that menopausal hormonal therapy was introduced decades ago, more than 50, 60 years ago, in different varieties, generally oral. And there was a very large study started in the US called the Women's Health Initiative that I would say misaligned their statistical analysis. So they got all the raw data and probably didn't analyze it as intricately as they could have. And in 2002, they published that lots of people were having heart attacks, strokes, and breast cancer. But they kind of apologized and tipped all of that on the head. In 2007, they republished and said that actually people that were of younger years, if they started it early, the menopausal hormonal therapy will reduce the risk of cardiovascular disease and stroke. And really, it's a very negligible increase in breast cancer that it may bring. And when I'm talking about negligible, 2 in 1,000 Caucasian ladies, because that's the base of the population, would get breast cancer if they didn't have a family history and not on menopausal hormonal therapy. And 4 in 1,000 may get it if you were on menopausal hormonal therapy. And you may say that's a doubling of the risk, which is true. But actually, if you then drank a glass of wine every night, actually, I think it's 2 glasses of wine, 1.5 Australian glasses and 2 UK glasses, you increase your risk of breast cancer by 12 in 1,000. And if you exercise 30 minutes or more every day, you reduce your risk by 8 in 1,000. So the relative risk for having menopause hormonal therapy is quite low. And that's trying that initial information from the Women's Health Initiative is definitely difficult to shift in some people's minds because it was such a large study, like over 90,000 women were in that study. So everyone really did want to stop and listen to it. But it's the same people that are saying that it's very, very, very safe. So for a long time, we used the oral contraceptive pill instead of menopausal hormonal therapy. Now, the pill also has estrogen. So it does help with some of the symptoms. I think that's what you mentioned.
I think that's definitely helped with me, my moods. Definitely as I started getting closer to 50, I was noticing things about sleep patterns that weren't necessarily the greatest, but my moods and everything were great because of being on the pill.
For a long while. Yeah, for a long while. And then there was a shift, I think.
Yeah, closer to 50, I think that it just wasn't enough. It wasn't enough to keep myself stable, I guess, if you will, or balanced, I should say.
There are synthetic hormones and then there are body identical hormones. And I do feel that the large populace of the conventional doctors understand that the body identical hormones are slightly superior in treating the perimenopausal and menopausal symptoms like the mood disturbances and the crawlings under the skin and the aches and pains and backache. And recently I found that if you have gluteus tendinopathy, which is the tendon just behind the bottom, it's definitely an estrogen change.
That's me.
Yes. And I'm actually wondering if that's
the crawling skin
too.
Oh, there we go.
But also for those of us that do exercise, like I do a reasonable amount of exercise and I find that I'm always getting really tight glutes. And yeah, I'm wondering if it's a vicious cycle because you are doing that exercise all the time, which is then putting stress on your muscles and your joints. And yeah, so that's one thing that I'm I feel like is very much applicable to me at the moment.
The estrogen is supposed to help with collagen, fiber. Now, this is when it comes to microscopic lab medicine, which I'm not good at. But the collagen fibers are organized better with the estrogen. So sometimes our tendons, well, certainly the gluteus tendinopathies helped. So, yeah. So whenever I see that now, I launch into this discussion about perimenopause, and I swear my patients think I'm crazy when I start talking about that. But that's something
But like
else.
you wouldn't think that tight, sore glutes would be related to perimenopause. Like that's why I think these conversations are so important. That probably would catch a lot of women off guard, you know?
Absolutely.
What about rage? Menopausal rage.
Menorage, you mean?
Menorage.
Rage.
Menorage. I feel like it
So
needs its own title.
I feel like my being on the pill that's one of the things that I feel has kept me very balanced. And again, I don't mean to trivialize or gaslight myself, but when you are incredibly busy and your tether, your leash is very, very short, there isn't a lot of bandwidth for, just for things. And so dealing with a teenager and constantly having to repeat yourself and stresses with work, like that inevitably does mean that you have a short, fuse at the best of times. But yeah, I was saying when I went back to Canada a few years ago for my
Canadian trip.
my high school reunion.
Full of denim.
Yes, it was definitely in Canada, lots of denim on denim. Like there was no mistaking where I was.
We've had lots of laughs about
this was
Jess.
not even fancy dress. This was typical standard attire
in a school reunion.
But I I went back and I was around people exactly my age, whereas here I'm a little bit older. So I might have been the first person to experience a lot of these symptoms. But going back home to my reunion, we all congregated in the bathroom. And first of all, the funniest thing was that everyone was really hot. Everyone just came out of like the
ladies,
the dance floor area. And then we're in the bathroom, just every woman was complaining about how hot it was. So it was like, that was symptom number one. But sadly, a lot of them were talking about the rage, and about 50% of them had ended in divorce because it was paralyzing almost. And I'm really glad the fact that I was on the pill. I felt like that had been really satiated, if you will. That wasn't something that I had experienced. But I could really identify, and I really felt for a lot of the people that I went to school with that weren't on the pill, they weren't on anything. And the rage was all consuming. And they joked about it, calling it menorage, that it should have its own.
It was really good that they knew. So is that part of because you said they were all your age, they had a community of people?
I don't know. The girl that mentioned it is a nurse. And
Right.
so she was like the calmest one of all of my friends. And even she said that it was all consuming. And she'd had, I think, a 20-year-old at home and another son that was living outside of the home. So like not in the thick of it of, where I feel like I'm having to remind my son to shower, brush your teeth. Even though he's 12, he still needs those reminders, do your homework. And it's that everyday monotony where you feel like you're going crazy because you're asking the same thing many times. So she wasn't even in that. And, for her to even comment on the rage, but I don't know if it's because she was a nurse that she was a little bit more aware of it.
She probably was, and she's probably taken steps to address it. Like probably sometimes I'm in a really great situation, like that I know what I can do to try and help. And that's probably what we're talking about today, to give people good access to information about how to help themselves. But it's so relevant as well that you mentioned about family, like in terms of partners and children. And actually, Teresa, you also mentioned now you recognize when your mum was really depressed, and how lovely of your father to have put, his arm around her and say, how are you? Are you okay?
Yes, well, he did his best, but bless him. But, going on that rage topic, I remember very clearly, I never used to ask my children to do things, I would shout at them. And I remember my son very calmly turning to me, I think he would have been about 14 years of age at the time, and saying, "Mum, you don't have to shout. I got what you were
Sorry
saying."
to say that's happening to me right now
Yeah,
too.
I feel like I shout less because I have been on the pill, and that's why I've stayed on it for the last 10 years and am now transitioning to a proper menopausal
I wonder how you're going to
treatment.
feel when you're on the other hormones, because
I'm a
I've
little bit
promised you the
nervous.
world.
I'm doing it after my holiday just in case so that I don't shift anything too
That's right.
severe.
And trying to get
But
1.2 grams of protein per kilogram while you're in Italy is going to be a bit hard
it's
too.
not Italy, it's France. So
France,
I should be able to, I should be all
all
right.
In between the croissants.
Yes, exactly. But yes, there was a point where I was shouting a lot, and I really didn't like the person that I was becoming. And there's an element of those young child years where, you yell because you've asked 5 times. So there's an element of that. But at the same time, I do appreciate that the pill at least has made me feel a bit more stable. And I
think any type of hormones are helpful. And like, as I said, the pill is so helpful for people that require contraception. There are other versions of contraception we can use in the perimenopause, but the pill is absolutely the right thing for some. The contraceptive pills that include estrogen and progesterone together rarely have had research with women over the age of 35. They found that possibly we had more clots, like venous clots in our legs, and therefore the companies decided not to try and gain ethical approval for studies over the age of 35. We do have newer pills now that have had and dived into some evidence, in the later years, but probably no pills have had research over the age of 45. So some of the conventional doctors really do try and push us to come off the oral contraceptive pill with the risk-benefit ratio and replace the hormones in a slightly safer fashion. And menopausal hormonal therapy with transdermal estrogen and body identical progesterone seems to be the safest option. But the other varieties with oral menopausal hormonal therapy are also very good, and the risks that they bring are minuscule. And definitely we do need to talk to our own doctors about that. But one of the things that was highlighted with people that moved, they may have an improvement in sleep when they started the body identical progesterone, and some of the anxiety that's already been lifted with estrogen can maybe be bettered with the progesterone, and it reduces our risk of the clots that we talked about, which is really, really useful.
I have never been on the pill. Well, that's a lie. I went on the pill for about 6 weeks and had a gallbladder spasm.
Oh, wow.
Which they put down to the estrogen
In the
pill. So that was that.
Yes. And did they say that you couldn't use it again after that?
Yes, they did.
Yeah, because you're so sensitive to it.
Yes.
Yeah.
And that's when I was, 18.
Wow.
So never been on any hormonal replacement therapy. I definitely felt that the perimenopausal time was the worst for me. That was when the rage was kicking in.
And maybe the pill would have been so useful at that time.
Would have been useful at that
but
time.
But the pill also has some issues with people with migraine and aura. And the pill also has some issues. We don't like to prescribe it with people with protein C deficiency, things that will make your blood clot faster. But transdermal estrogen doesn't seem to have that issue. So actually you not being able to take the pill for other reasons doesn't exclude you, from trying menopausal hormonal therapy. So people with migraines with aura can use it.
So I don't suffer from hot flushes. Never have.
You never have?
What about heat? Do you feel hot? So did you have times in your life, which I think every woman probably does if they have children, that, the kids kind of jump into bed with you at midnight and they've literally got the covers up to their neck, but you're like, I'm going to take the covers off.
I might have, look, I think I still do at some stage, maybe feel a little bit hot, but never had the hot sweats per
That's
se.
right. The sweats and the heat, I think, traditionally were the ones described by doctors because we didn't want to prescribe menopausal hormonal therapy. So really we needed a good amount of dysfunction before we wanted to prescribe it. So really we described the woman that's going hot while she's talking in a meeting and she's then fanning herself and stripping.
Yes.
Whereas now, knowing that some of the treatments are so beneficial for bones, any of the treatments, whatever we're talking about in terms of actively managing the perimenopause and menopause, I say actually having a hot flush is probably an old term. Being hot, the way you look as well, but being hot in a situation you shouldn't be. Children, because of their body mass to surface area, lose heat less than others. So they are generally considered hotter, they feel more hot than, an adult. So if your child is saying, goodness, mum, I'm cold, but you're like, really? I need to take the sheets off. You may then think, okay, this might be my transitional phase starting. So that's a difference.
I definitely felt that before in that small window where we weren't trying anymore. And then I went on the pill. I definitely remembered feeling that. And it was stifling. Like I'm very glad.
Were you the lady with the fan at that time, or?
I had aircon at home, so that helped. But yes, my husband was wrapped up in the blankets and I had them off and pools of sweat in your boobs. And like, it was not comfortable. No. And I have a friend at home who's got, she had a heart condition that they think was hormonally related. So she can't go on any menopausal hormonal therapy. And she said that it almost made her feel like was going to vomit. Like it was just so sudden, the feeling of being flushed, and she felt nauseated. And it's not just a symptom. Like she was at work, she had to go excuse herself. And that's another aspect of this. Like we're not ready to be put out to pasture just because we're done our childbearing years. A lot of us are in the more senior positions work-wise.
Well, absolutely.
So this is something that we really need to manage.
100 years ago, we were sent upstairs to do some embroidery. So, now I feel like I don't have that pleasure.
No, we don't have that pleasure. I mean, our working life might go on into our 70s and 80s. It's
and by choice.
By choice.
By choice, yeah.
And I think we have value to add.
Exactly.
Oh, I think more than that, we have the value to add. But I was also going to say that's to do with cognition. So lots of people come to me and say, can I be on hormones? Because I've heard it helps with memory. So
I definitely felt I had an aspect of brain fog. And from a work perspective, I'm always on my computer. I set reminders and things like that. So I don't feel like I've dropped the ball with work, but it's just everything else. There's just so much. There's always, I go upstairs and I've forgotten why I've gone upstairs. I go to the shops and there's something I've forgotten, and
it's the overwhelm. I think you described it
I definitely
so well.
feel like the brain fog. There was an element of being overwhelmed, but also that feeling of brain fog as well.
And how did you manage that, Teresa?
Well, again, it seems that I had the roughest time in that perimenopausal time. And I was managing a very busy...
How long do you think that lasted for you?
I would say I went through menopause at 42. It's really early.
So you're saying when you say menopause, the definition is you hadn't had periods.
Hadn't had a period.
For 2 years.
2 years.
Goodness. Okay. So that was quite early.
It was super early.
Hence the grieving. Like that is
very early.
It's much earlier.
Even though you've got some beautiful children and many in my counting, I feel, and you're brilliant.
But you were lucky that you obviously started earlier.
I was lucky.
I know someone who had a child, at 40. And so that,
Yes. Yeah, well, that would not have happened.
Yeah.
So I think that perimenopausal stage where I was, a bit angry, shouting, anxious, etc., went to about 50. And then it was like the clouds lifted.
That's a long time if you're
It
thinking
was 8 years.
Yeah, I was just going to say 42 to 50. Like that's a massive impact
8 years
on the family, on relationships, on work.
Certainly was.
And you also mentioned that like the family is so very important and the community around you to help you and be kind to you, and you also being reflective and being kind to yourself. Like, I'm allowed to be forgetful. That's okay. Or, goodness, forgot the time I had to get to the car and here's this very big parking ticket, which this has happened to me. Because, an hour out and you walk in, you're like, excuse me. Oh, goodness, that was me. That was my fault. So being kind to yourself and allowing it, as long as the bank balance allows it, is so important. But then how to communicate that with family. So basically and it is about communication. This is something that probably needs to be a dinner conversation, maybe brought up as a laugh, and I think the majority of my friends and patients say the way it comes up as a laugh is dry vaginas. And, someone brings it up as a laugh, and then it can get a little bit more informative, especially for our families that are not understanding why there's wild mood changes and fluctuations. And it's helpful if they're receptive, but sometimes that's hard too. We can't.
Yeah, particularly if the symptoms manifest in rage and things like that. But I did say, like, my husband does, like everyone else, love scrolling through his phone. And I just said one evening, just have a quick Google of menopause and the breadth of symptoms. And I think you'll be surprised that it actually affects almost every aspect of a woman's body. And you'll just get a bit more of an understanding. Like, I noticed it in my digestion. I noticed that things took longer and, and then you'd get bloated and just little things like that. Like your body just is not behaving the way.
Did your partner actually do what you asked him? Because that's also
I never followed up.
Yeah.
But I did say, like, just have a quick Google. I think you'll be surprised at all of the things that
I have to say, normally my phone's listening, and whatever I say out loud in front of the phone, then the adverts seem to follow.
I doubt that his Facebook suggested posts are going to be of hormone treatment, like what mine is.
How to survive your wife in the perimenopause.
But I do hope that he took that seriously, just to have a quick Google to see, and to, I think it surprised me that it can literally affect every part.
Once a woman knows what's happening, it is quite empowering. So the Women's Health Concern in the UK has done quite a lot of leaflets on, the perimenopause, menopause, the history of hormones and why we loved them, then hated them, and now love them again. Jean Hales, the website in Australia, also is a helpful tool to have a think about it. You could also Google the green scale in Australian Menopause Society. And that's a really quick tick box of the cohort of symptoms. And it really does show, the gradings are out of 3 for every symptom. It really does show, ladies, that the hot flushes are there as the 1 box, but mood changes, unloved feelings, anxiety, depression, actually total of 12 to 15. So we've kind of knocked everything around now and know that part of the, as you put it, brain fog, crawling feelings, joint pains, dryness. And the other one that I hate that is always put down to having children is running to the toilet to have a wee. Like that's also part of perimenopause and menopause.
I do feel like that's what gets me out of bed.
To run, to go to the toilet.
I don't need to run, but it's, like I...
maybe now you have a preteen because I have a 5-year-old. Normally someone's jumping on me first. So, yes. Building a community is so very important, and the community are usually friends, and you said like being of the same age is important, but I also wanted to include the younger ladies to know what might be coming so they can prepare either their career plan or their family plan or their living arrangements, to understand what they might need to do to help themselves.
Or just not be caught off guard when they start experiencing changes in mood or sleep or what have you, and to recognize that this can be related.
It can be related. It can start late 30s. So the transitional phase is not a constant reduction in hormones, but it's a fluctuating pattern of hormones. up and down.
I find there's a lot of fear from younger women about menopause. So they're coming up to 38, 40, and they're starting to notice the changes. And then they want to get their hormones checked because they're terrified that they're going into menopause. And I always say to them, look, your skin doesn't suddenly fall to the ground. It's not
Thank
like
God.
that. You don't suddenly lose your teeth, your hair, and your bones don't, crumble. It's a much slower progression of, not for everybody, but, symptoms. What do you think about
The hormone
getting hormone
testing?
testing?
Yeah, so thank you for that, Veed. Actually, you're right. Lots of people come to me as well and ask for blood tests. And I'm quite clear. There are two reasons for people to ask for blood tests. One is to check their position in fertility. And the other one is to check the fears that, the symptoms that might come with perimenopause. Well, perimenopause and menopause, I would suggest, is a clinical diagnosis. And I mentioned the green scale earlier, which you could do a quick green scoring at home, through the Australian Menopause Society in the PDF copy, and take it to your doctor. That might help you qualitatively assess where you might be. When you look down the symptoms, you do think, goodness, this could be for any reason, like unloved feelings. That's because, I asked for the bins to be put out and they haven't been put out. But unloved feelings are across the board with colleagues, and that could be because your work stress. But the idea is menopause hormonal therapy and all the active interventions with exercise, nutrition, and vitamins may it be vitamin deficiencies that might also exacerbate the symptoms, are helpful for you as a person. So the idea is going in, asking for a blood test. We might say yes as doctors. If it was the fear of fertility and ongoing fertility, there are blood tests that help us understand if you have a low ovarian reserve and whether we need to act fast if you want to move ahead with children. And I definitely don't like people to retrospectively regret not having that active intervention. For those people, I do feel like blood tests are helpful. But when it comes to measuring estrogen and progesterone, that's very unhelpful because our levels,
I would imagine it would change
all day throughout the years. So if I got a normal, I would very much hesitate to say they're not in the perimenopause. Also, if I got a hormonal level of you didn't ovulate recently, when may it be in the last month or two, and it suggests a menopausal state, I would hesitate to say you're menopausal because the ovaries can wake up in this transitional phase. And so a blood test is not helpful. It is to do with understanding your symptoms and how they have changed from your baseline and whether you're managing well in this phase. Yeah. So thanks for that, Teresa. I think that's a really good piece of information to understand before you go to your doctor. The other thing I notice is lots of my friends might come to me because they worry that they can't seem to get the right answer from a doctor that they visited about the perimenopause or a health professional. What's your experiences?
So again, working in the practice with GPs, quite a few people ask me questions. If they've been through breast cancer, should they have an estrogen hormonal replacement therapy?
I think that's a very difficult area because breast cancer, by the way, the treatments have come so far and I'm so grateful for that. There is many varieties and now we can classify them. Some people have breast cancer with hormone receptors and some without. And we worry once there has been a cure or remission that we do not promote another active episode. So definitely hormone positive cancers are a no. And for now, I think even hormone receptor negatives are a no in terms of systemic treatment. I would say there's a lot of evidence to be done. We learn more about cancers all the time. I probably wouldn't personally like to have one of my patients on estrogen versions, but there are other things like phytoestrogens that we talk about a lot. And the other estrogen that no one talks about is estrogen 3, which is the vaginal stuff.
Yes.
So that I'm not sure whether you've heard of, and you can have that as an extra. And that for a patient with breast cancer, or otherwise, even with a lady that's on hormonal replacement therapy, is an additional support. So yes, going back to the dinner party with, the dry vagina is the first start of a funny conversation. Dryness is definitely something that happens, and it can be variable. But if you start to have recurrent urinary infections, that could be something to do with our vaginal biome or vaginal, acidity changing. We might want to consider having some estrogen 3, which comes as a cream or a pessary in Australia and in different varieties in different countries. And you apply it usually frequently every day for the first 2 weeks, and then you can reduce the frequency to maintain things. So that's something that is accessible to all. And because the estrogen 3 doesn't affect breast cancer or body receptors, it's normally the estrogen that helps vaginas, bladders, and ureters. That's something that is accessible.
I think that's hugely important because I do appreciate that it stemmed from a laugh, but with that is often associated with pain, and that then can have implications in the relationship if you're not having sex as much, and that does have a downward effect. So it is good
with the relationship, and you're already having the menorrhagia.
Yeah, and so I think that that's an important thing to raise. It's good that it's first in a joking sense, but if left untreated, it can actually become a bigger issue in the relationships.
We talked a little about phytoestrogens. So phytoestrogens is like a fancy word to say plant-based estrogens. And we probably don't know enough about them. And lots of people ask me, should we have a bit of soy and should we have some things? And I say, look, little of everything is fine. I don't think, and maybe I could get your help, that there's no real understanding of risk with phytoestrogens, but having high varieties might affect other things. I thought soy also gives you a urinary urgency, like needing to go to the toilet, and frequency.
If it does, it hasn't.
For you? For you?
For me personally.
Yeah.
I think the thing with soy is that some people overdo it.
That's it, a little of everything.
It's a little of everything. And if you look at the way that the Japanese eat soy, they might have a little tiny amount of edamame, or they might have a few slithers of tofu in the miso, or they might have a couple of slices of a deep fried tofu. They didn't really drink soy milk per se, but if you're drinking it, well, keep it to a minimum, 250 mils, just don't overdo it. And look at the various types of soys. Is it genetically modified? What else is in that product? Is it a pure soy and water product? Has it got additives and fillers and gums? And, that then takes it from a soy product to something that we don't really understand.
A little of everything.
Little of everything.
Is a good idea. Yeah, but don't come in and say, well, I've tried to have, soy for breakfast, like a large soy flat white, or and
multiple
during the day is probably not the right way to go. And while we're on the other options like herbs,
yes,
that's a big thing that lots of people try prior to, seeing a doctor, and we're lucky that we've got things that are over the counter in Australia. I don't know whether you tried anything.
I have recently been hearing a lot about moringa and its anti-inflammatory properties and helping to reduce cortisol.
There are so many herbs out there, but it's so hard for conventional doctors because the evidence only gets us so far. So what we really want to do is do everything right by you as a patient, and also not do anything wrong, so not cause any harm. So you do need large level studies before you can spread the good word. And sometimes the herbs don't get the largest level studies, as we have had, for example, with the WHI and medication, because there's a lot of input with money. But I actually don't know much about moringa. I do know that what you had said was black cohosh that is available over the counter in the majority of countries. And it's probably been approved as a not licensed product, but a certified product. So the difference between that is herbs get certified by our medication authorities. In Australia, it'd be the TGA, Therapeutics Goods Administration. In England, it's the MHRA. In America, it's FDA. And the certification suggests that this product doesn't have too many heavy metals. It has that dose of herb in the capsule, as it says. But when it comes to licensing is, it definitely does what it says on the tin. So the licensing is hard because we don't have a lot of evidence. So some people do feel like black cohosh helps with hot flushes. It is considered a phytoestrogen. And it is available over the counter. But I think it's good to speak to your doctor or practitioner about whether that's something that is helpful for you. Nowadays, I think the pharmacists can also help you with that type of discussion. So sorry I couldn't tell you a little bit more about the new one. That could be some further reading for me. Have to keep up to date.
It isn't new, and it does have a lot of promises about a lot of different things. So, if you're thinking about herbs, there are something like 144 herbs that Western herbal medicine practitioners use, or traditional naturopaths, and then you've got traditional Chinese medicine, which probably has another 1,000 herbs. Wow. So it is never a one-size-fits-all. We don't know the interactions, largely. We don't know the interactions between herbs and medications. There is not one reliable source. I mean, yes, we have interaction checkers, but we still don't fully understand the herbs.
It's nice that you said that out loud, because it's hard sometimes when people come and ask a doctor, and my colleagues are, quite sad that they couldn't advise. But we also, I think, as doctors need to explain better the risks that might happen if we did advise. Yeah.
If you are going to use a herb, then at least speak to somebody that is university qualified. Don't take it because your friend said it works, and don't take it because it's heavily advertised.
Fair. Very fair. We do have the authorities are great. They do check that there isn't, a liver injury that's associated with case-by-case use. So we can check a few things, and the stuff that's ended up on the shelf mostly that have a TGA certificate in Australia, you can see that online. And, some of those things are available after speaking. Tell me more, Teresa.
But, and lots of people buy things from overseas.
True.
And we can't promise what's in it.
Correct. So yes, the stuff that's not made for the Australian market, and you can't find the certificate, which is usually publicly found. It's difficult because you don't know what's in the actual capsule. And sometimes it's definitely infinitely cheaper because the company hasn't paid for that certificate. That's the issue, isn't it? Vitex is one that some of my patients have used for transitional changes, like cyclical changes. So Vitex is a chasteberry flower. I think it's purple.
Yes.
It's very pretty.
It's lovely.
Yeah. And some ladies use it in the PMS period. So I do really think reproduction cycles in ladies are just a continuum. I know we have titles for different times of our life, but we probably don't actually have a stable time. We don't talk about between the mid-20s and 30s up to the late 30s because some of us are pregnant at that time. So we may not know a lot more, but we have the issues in the bringing in the periods, and we have the issues with the exit of the periods. So Vitex is probably something that is useful in all of those. Do you agree?
Totally. I use it a lot. But I use the one that has tried and true research behind it.
Correct.
So that's not always, some of the supplements that are on the shelf may not have the standardized extract in them. So I'm very careful about which one I prescribe. And that's one of them. And there are a lot of other, small herbs and nutrients. And of course, you can't go past menopause without talking about magnesium.
Oh, yes. Very, very, very true.
For its sleep benefits?
Sleep, blood glucose levels, blood pressure levels.
So it is a relaxant.
It's a relaxant.
So it's, all muscles require magnesium to relax. And that's the Epsom salt baths that, I do try and do. And you also tell me to do. And we're having a difficult conversation. You're like, you forgot to do that, Angeli. So, the Epsom salt baths are magnesium salts from the Epsom cliffs in England. So, and because I love England as well, I would definitely do that version. But yes, you can ingest it. Powder being better than tablets.
Yes, definitely.
Because of the greater surface area.
And you can actually buy sprays that are quite useful for muscle aches as well. So
just have to be careful again that they have the certificate.
Yes. Well, there are brands that we talk about that are more efficacious than others.
So yes, magnesium actually is very important. And if your sleep improves and, generally I have two versions of doctors, one that says it's no use and the others that say, my friends that say it's useful. And I say, well, it's kind of not harmful because if anything, it may be harmful to your pocket if it was a bit expensive, but it would give you a bit of loose stools if you took too much because it's a great laxative. So,
and I also had a conversation with another doctor at work about the fact that some of the magnesium powders have additional nutrients.
That's right. And that's difficult.
And
I would say
difficult.
You've got to try and be careful that you have the stuff that is recommended rather than the extras as well, because I think you're talking about B6.
I was talking
Yes.
about B6. Yes.
And excessive B6 is quite harmful for nerves and can cause tingling and funny feelings, whereas B6 is also pushed to help in small amounts for anxiety. So it's really hard to work out whether to take it. So if you're not in doubt, I would say don't.
What a lot of people do is self-prescribe, and then there's B6 in the magnesium and
They've
B6
forgotten to check the
in
supplement.
their multi and B6 in their B complex and so on and so on. And that's when it becomes
In excess.
in excess. Being a person that's never had any hormonal replacement at all, is it possible at this stage of my life?
Am I allowed to? Well, shall I say that
You can say I'm over 60.
even though you don't look it. So I wanted to highlight how well you've done, right? Yes, absolutely. Even though the Women's Health Initiative was the largest study, and that's why I keep reverting back to them, even though they did make some big mistakes, say that there could be some problems with starting menopausal hormonal therapy more than 10 years after you have finished your periods. The hormones keep everything soft and supple. So our heart and our brain tissue is part of that tissue group. So skin is also the one that everyone talks about, but we have internal skin. If you think about all the vessels going around your heart, without the estrogen, mainly is what we blame it on. Without the estrogen, that can get quite hard, calcified, but actually quite stable. So think of the cholesterol plaque within the vessel being quite stable. If you then, after a delay of it being quite stable, maybe little micro bits do come off and there is a risk of heart attacks and strokes as we age. We call that natural aging. And what happened with the WHR was they gave hormone replacement for people that had been way past their last endogenous within their body estrogen surge, which meant that those stable plaques may become soft and unstable and then move.
And release.
And then they can then cause a clot in a very important blood vessel. When ladies come to me and say, look, we're in that range, the range that we might not be safe, what would I do? I say it is, from my perspective, the lady's decision and their doctor's decision. Their doctor may not just be the one doctor. Their doctor may also be a cardiologist who does a risk assessment, a neurologist. They may need to invest in all of that before considering whether they wanted to go on a menopausal hormonal therapy. There may be then eventually, after all the risk assessments, they go to a specialist centre to talk about their symptomology, and then the specialist gives them menopausal hormonal therapy. I'm not taking this out of the hands of some family practitioners, for example. I'm quite happy to try and risk assess and then put it to my patients that there is a increased risk of vascular issues, vessel problems that may happen quite early on after starting a menopausal hormonal therapy. Testosterone is a part of the menopausal hormonal therapy, and hormones being estrogen, progesterone, and testosterone. Testosterone is a female hormone. It is required. Testosterone is usually made in the peripheral fat for ladies from estrogen. So I don't like to start testosterone until I've established them on estrogen, but that may not be the right way for some. So you can have testosterone independently. Have you guys thought about testosterone?
Absolutely.
It's been asked. I've not thought about it for myself, but I have had people ask me about that. I've heard from like a libido point of view, but then also a building muscle mass point of view.
Testosterone is so useful for ladies for libido, and that's definitely been evidenced, and libido is part of our quality of life.
You definitely notice in menopausal times that you're losing strength, grip strength, and the strength to lift like you used to lift premenopausally.
But in terms of muscle mass, there has been studies, but they haven't found for ladies that the muscle mass is improved. Probably the estrogen and progesterone when you first establish helps that a little. But, never say never. And we probably need more and more research to know whether testosterone truly helps ladies. It truly helps men in their metabolism changes as they age. That's probably to do with their testicular changes and if they go into testicular failure early. But I'd say actually even the men just need to exercise, and that builds up their testicular function and their testosterone. That's definitely the first way to go. But the cardiovascular risk and the vessel risk, similar to what I had mentioned with the estrogen, is why we worry about testosterone in maybe certain age groups, certain blood clotting disorders. Family practitioners or GPs in this country are usually very up to date and want to help you, and potentially these type of things might be done by a family practitioner or move forward to a specialist if that's not their specialization to risk assess. The idea is that if I did then find someone was high risk or even low risk, I want no risk. As a doctor, the doctors are here to help you, not make life harder.
Can you talk a little bit about estrogen and bone?
Estrogen helps our bone metabolism and building blocks. So we have osteoclasts and osteoblasts. Now, if you really want to, you can go and look at what those are. And there's more to understand about bone than just those. But we have the builders of the bone, and then we have the builders that are removing bone, and this happens constantly. Estrogen helps the proactive building and the less of the removing. So it does help with osteoporosis and reducing the risk of that. It probably doesn't increase bone density, but it will maintain bone density and help
Good
that.
to know.
If you have then estrogen and you want to improve the bone density, we go back to all those other factors like protein. How much protein are you having? How much weight-bearing exercises are you having? So all of this is a interlocking puzzle that has to be done together.
That was definitely one thing that I took from our conversations and my conversation with my OBGYN is that it's not a one size fits all, and what works now might not work in 5 years. So it's definitely an ongoing dynamic discussion.
The transitional period, which we now call the perimenopause, is such difficult medicine for a doctor, because I think some ladies want to come in and they want to have a prescription and then go away. But the issue is that because our hormones are changing so wildly, we actually need follow-up a little bit more often. like if I gave a particular cyclical regimen of menopausal hormonal therapy, I may actually need to change it in 4 months' time. So there is an investment in your health, knowing and loving your doctor. Being kind to yourself is one thing, but also may I press to be kind to your doctor as they kind of catch up with how you've done.
Yeah.
And
establishing that relationship. And
so they know what your baseline is. So having a regular doctor is so important. But also considering that there's such a large cohort of symptoms, I do sometimes feel the overwhelm when someone comes and loads all their symptoms on me, and then I'm supposed to say, right, this is perimenopause, because that's what they've come to as their provisional diagnosis. Now, I actually never say no, because I believe in a trial of medications to see whether all those cohort of symptoms actually recover. Because I do feel that if I've done the correct risk assessment, then our treatment path would help if it was perimenopause. It does overlap with, genetic or family inherited mental health issues or other things, but I'm not so averse to that. But the biggest thing is building that community, having a lovely doctor who you love and they love you. Yes.
And just having that discussion.
Having a discussion about it. Yeah. Mm-hmm. Should we talk a little bit about weight gain, which is the elephant in the room?
Oh,
yes.
I love that topic. It's such a loaded topic, I think, because without a doubt, you notice that your waist gets bigger. I know that. No other part of me got bigger, but my waist definitely did. Did I gain weight? Not necessarily, but then I did up my exercise regime. And I think my thoughts around it were along the lines of you kind of have to exercise forever. And you don't just sort of go, right, well, I'm now at a certain age, I'm going to take it easy. That's not how it works. If you look at how our parents actually managed their lives, I remember my mum hand washing pure cotton sheets. Can you imagine what that would be like?
My goodness.
Yes, scrubbing them on a board
Wow.
and then picking them up and putting them through a wringer.
That is exercise.
That is exercise.
So are you telling me I've got to throw my washing machine away?
Yes,
Because
I
I
am.
will.
Yeah, you've got to go back to that.
Friendship with you. Oh my God.
I'd rather just stick to my 4 kilo weights. And
That's at the gym.
You really
But
do
it does
need
minimize
to.
what we're doing then. It does minimize what we're doing from what we used to do in life.
Yes.
And walk to work.
Yes.
That might have been
Drag
our
a
way.
trolley with shopping
We've
in it.
simplified our lives, but to your point, we then need to make sure that we're still getting that level of physical activity
Vital.
and compensating for that.
Maybe I will wash my sheets once a month or something. Show me the level. Can't even imagine.
Can you imagine?
No.
And she was a tiny woman. And then she would drag the shopping 3 miles to the centre of Plymouth, where I was born, and, drag that heavy shopping back. And that's without, the vacuum cleaner weighed about 5 kilos.
Yeah, no one had a Dyson in those days. Yeah.
No.
And they didn't stop, and I think, and
My
I'm
mom
guilty.
used to do the lawn mowing as well.
Yes.
And it, she's a tiny little thing and she was just sweating by the end of it.
Yeah.
And I look at what my husband now has and it's this compact battery operated, so there's not all the petrol weighing it, so
It's not a sit-on mower then.
No, my mom didn't have one of those, no, and nor does my husband. But we've simplified our lives. So I like the exercise component is that it's a lifestyle now and it's something that we are going to carry.
I did an experiment one day because I'm all about this. I drove to work, I worked, I went home, and I did 600 steps that day. That's barely even.
Nothing.
moving at
That's like going to the toilet. And
Absolutely.
And
But
so
a lot
many
of us do that. A
Mm-hmm.
lot of, sorry, we did that. We said that at the same time. Yep.
Synchronicity. You know, I know that exercise can be a chore for some people, but find something that you like. Find something that you love. It might be line dancing. I don't know. It might be rollerblading. Could be anything.
Or it could be a changeable activity, because a lot of
absolutely.
us get bored, and that's definitely me. Every time we go to dinner, I say we're trying to find something new for me to get my attention onto. But you're right about the weight gain.
is the weight gain just, do we just need to manage our expectations? Is that?
I think there's a part of that, but I think it's so multifactorial. So it's our sleep.
Oh,
It's
yes.
our body not thinking that we're under a stress. Perimenopause is a very big change in the ups and downs that the body faces actually puts us into stress. And that's where you get this discussion about cortisol. So cortisol does increase. We probably in conventional medicine don't chase that increase. We're aware that it will rise with stress. The idea is that then increases our centripetal, so mid-waist adipose tissue. So it's the sleep, it's the exercise that you put it down to, it's our loss of estrogen, whether we could address that, it's our protein content. And really, I sometimes have to be quite strict with my patients and talk about when they say we have such a great diet, but then they had a croissant every other day just to say well done to themselves. It kind of, for some people, that's actually for their body a bit too much. Like the excessive sugar and carbohydrate that they might entail as a treat might be too much. I usually say that if you've then hit your protein target that day, maybe. If you feel that you are doing well with your waist size. And the last thing I would say is there is a lot of talk about intermittent fasting. And I think that's very relevant for those people with insulin resistance. But when you're under a stress in your body, sometimes the intermittent fasting exacerbates that stress.
And I would think it would be hard to make your protein target if you're intermittent fasting. So,
well, intermittent fasting is actually squashing all the meals rather than missing.
Yes, but you're not going to be hungry in that small window.
I have to say, some of the people at my gym, which I joined for the 3 months of my attention span, they used to bring their snacks to get in between workouts because they were intermittent fasting. So
well,
they
all
were
of the research, not all of it, but
Yes.
the majority of the research on intermittent fasting was done on men. It wasn't
That's
done on
right.
women.
That's right.
So we are very different. We're not
We're
little
just
men.
complicated.
We're
Yes.
much more complicated. And I'm not a particular fan of it. And that's only because I looked at the research in muscle and intermittent fasting. So it wasn't for me. But, going back to that, to weight, there's a study that came out that women just increased their protein to 2 grams per kilo of body weight, and they lost body fat. They did nothing else. They didn't exercise any differently.
Wow.
And I think that's an important factor because we don't want to have that visceral fat, that fat around our
And it's about
organs.
eating consistently.
Yes.
So that's why I brought up the intermittent fasting, which may be the right thing for some.
Yep.
But it is, people go away a little astounded that I say, nope, can have some breakfast. And then what's your mid-morning snack? Like you mentioned, you took protein shake and I would rather them have an egg or something to chew, and then lunch, and then where's your mid-afternoon snack? And lots of my ladies in this period have reached, targets in careers. Most of them have. And they're like, well, we have no time. And then there's the preparation that's required. Yeah.
Definitely. Plan to succeed.
Correct.
Chop it all up, make it all, boil your eggs, leave them in the fridge, and you've got them there the whole week. By the way, I am a fan of protein powders because I'm sick of eggs. I'm so over them. But,
If you eat too many, do you fart is the next question. So I don't know. But I don't. So that's why you're still friends with me. But weight gain is definitely very complicated. It's not what we've said is the right thing for everyone. But I think as a base, that might be a good starting point. Weight is definitely one of my bugbears in the world, because lots of our governments haven't agreed that it's a public health pandemic, that, weight gain causes so many other things, and we really have to look at it as not just a lifestyle effect. I wanted to talk about perimenopause and menopause today, and the fact that both of those titles have been here for a very long time. I think that the titles no longer need to be around, because I think this is a transitional phase for any lady between the late 30s and the mid 50s, knowing that some of our treatments for both are now exactly the same, and things we thought were risky are now much less risky. Can I ask you about seeing doctors? Do you feel you can open up and talk about all these things easily? Would you go and see any doctor at your practice?
So I go to a big GP center. It was a good preliminary discussion, but I found an OBGYN on the Menopause Society's website who had a keen interest in hormones. So I go and see her, and she's excellent. So I do feel very comfortable in talking to her. You
found your person.
I found my person.
Yeah.
Some of the GPs that I saw were really lovely, but I did find that they were cautious in, they offered me a small script of something to get me to seeing this lady, and then I would further the discussion with her. So that was my experience with the GPs that I saw. There were no barriers with the GP, but it was better felt that I would continue the ongoing discussion with an OBGYN.
I actually think the medical community completely understand how important perimenopause and menopause is, as well as risk reduction, because now everything we do is reducing our risk of things like bone disease, heart disease now, and stroke risk. We actually do know that we really do have to address it. And I really love that you had that great experience, and the fact that you understood that if you saw a GP, there's no barriers. A bit like all doctors, we all have different fancies. I mean, I quite like everything, and I want to be the general family practitioner. But there are some people that actually just love one thing and they endorse that, and they know then where to send you.
Yeah.
You mentioned Australian Menopause Society, so I love that list. I feel like if you can't get anywhere with talking to your community of ladies about who to see, or your lovely GP who's your regular GP about who to see, then that's a great list to have. Generally, for us to be on that list, we pay just a fee, so that we pay a fee to say we like menopause.
So you're more visible to the community.
You're more visible to the community, and I think that's an easy way to go. But probably someone in that general practice, or even your own GP, would be absolutely happy to talk to you. And may I say also, for my male colleagues, some of them are so bought in to the perimenopause and menopause management. I would not exclude the men of our community. All of them are so helpful in at least talking and recognizing and validating you.
Yeah.
And we are all there for that. So I think you didn't have that issue, the validation.
No, I felt very validated and very seen and heard when I talked about my symptoms, both from the GP. As I said, there were no barriers to then discussing it with an OBGYN. So I certainly didn't feel gaslit that any of my symptoms were anything other than the need to discuss about perimenopause or menopause.
Just to help our listeners a little bit more, and also I'd love to know, like, what were your doctors asking you to prepare yourselves with before they talk to you about options? I was hoping you might say breast screening.
Well, yes. So that was definitely a regular a question that they did raise, but I guess I don't know if I'm a standard patient. I was already getting yearly breast screens, which were visible on my history anyway.
Yes.
So that was never a concern, very much up to date on my Pap tests as well. so that wasn't necessarily asked because it was visible that I was doing that.
And I think those two are like the most important.
Yeah.
And if I see a friend and they haven't done their mammogram, I say, excuse me, until our next glass of wine, it should be done.
Yeah, and no, fair enough. And I think as
that's Teresa
communities
raising her
and
eyebrows.
friendship groups, like we always make a point of saying that we've had our ladies tested and this is your public service announcement, and that you should go and a reminder for, because we all get very busy, but yeah, sometimes those reminders are
really
very helpful.
Are really helpful. I think there's that community thing you're talking about again, which is actually to get through this, we need a community of ladies and men and partners and children and everything. But yes, so you can get free mammograms in New South Wales and all the states actually in Australia. And you just have to ring up the breast screen place and go. And people talk about the squashiness and how much it might hurt. And I say, well, you just got to hug the machine.
Yeah, I mean, it's not hugely comfortable, but it's not uncomfortable.
Painful.
It's just over before.
I think it's actually the ladies that pull back. Do you know, like when it squashes down and you're like, oh my God, what just happened? And then you pull back. I think that makes it more painful. Saying that to Teresa, and she's like, do I have to? What makes you hesitate to go?
I have very cystic breast tissue.
As do I.
Do you?
I get ultrasounds every year and mammograms every 2 years.
Yeah. And what I really don't like is sometimes they'll go, oh, it's cystic breasts, let's do a couple of needle biopsies. Oh, wow, but you're right, I should go back. But going back to, your GP, I think it's the empathy factor. If you have a GP that's listening to you and is empathetic, then that's your person. I think some people are not totally comfortable talking to their GP and they just need to find the right person.
Well, being a GP myself, can I stand up for us and say, might be time. So if a lady quite rightly says, there are lots of ladies that say, well, this is perimenopause and I've done everything that was required. Like I've done my breast screen and somewhere else I'm up to date with my cervical screening, right? Because now it's so easy, you can do it yourself. Then they kind of book in 10 minutes. And I actually feel like we need longer. So the empathy might come with time.
Especially if it's the first discussion.
It takes a lot, because we may have kind of talked about
so
this
maybe
for
your
an hour.
Listeners to be aware that if this is a topic, to let the front desk know.
Yes,
and to be aware of the time that's needed.
It's sometimes intrusive as well for a patient to say to the front desk, look, I'm about to talk about my perimenopause and menopause.
Well, you can say I might need a longer
I think that's all it is.
Yeah.
I think that's all it is. Disclosing all the detail is not required.
No.
Yeah, because that's definitely disclosed.
I have a lot of questions and I might need a longer
appointment. And it may not need. But I do feel like the empathy comes with less time pressure.
Yes.
So that's so important to understand that being kind to the doctor might actually get you where you want to be. I'm so grateful that I could spend some time understanding your experience and talking to our listeners about this very important topic. Thank you for coming. Hopefully I'll see you next time on the first consult.
Thank you.
Thank you.
Thank you.
Right, I shall now go punch somebody.
This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The views and opinions expressed by guests or hosts are their own and do not represent those of any medical institutions we may work with or be affiliated with. While every effort is made to ensure the information shared is accurate, listeners should always consult a medical professional with any concerns or queries. Never delay seeking medical treatment based on something you hear on a podcast. Reliance on any information provided is at your own risk. If you are experiencing a medical emergency, please call emergency services or seek immediate medical attention.